All right, this sign is the version of me walking into a health club and saying, "You people have to lose some weight." Democrats putting the sign out, "Make America Sick Again," blasting Republicans for compromising a health care plan that they say will make America sick again, even though I reported statistics at the top of the hour that show Americans are sicker again. And the death rates are going up. Life expectancy rates are going down. 8 out of 10 top diseases are killing us in numbers that we have not seen in decades. So we thought we'd find out a doctor and get the medical read on this and whether she's worried about it. Dr. Elaina George, she's an ear, nose, and throat specialist. That specialty alone, by the way, you have to be like a super genius. So, doctor, very good to have you.
It's a pleasure to be with you. Happy New Year.
To you as well. On this issue, doctor, help me with it, because it seems that I'm not linking the two, but when I hear people who are pushing this program saying that those who don't support or have problems with it are making Americans sick again. We're pretty sick already, but what do you make of this, and whether it's made your job easier, your patients' lives better, what?
The Affordable Care Act has not made my job easier, has not helped me take care of my patients. It's actually been a hindrance. And I think if you look at more statistics about the movement of private doctors out of their profession, either closing their practices or buying or actually selling their practices to hospitals and becoming employees, you can get a feel for how tough it is to actually practice medicine using the Hippocratic Oath. It's been open season, really, on doctors and patients. And I listened to the beginning of your show, and you mentioned that you thought that maybe some of the problem was people not being able to access because of the cost of health care, deductibles and out of pocket. And you were right on target when you said that. It's not that the health care costs are going down, it's that people have have a plastic in their pocket, but they can't afford to use it. And that's not appropriate. And to politicize it and make it seem as if it's winning at all costs at the expense of patients, I really do take offense to that.
Now, I don't know how your patients break down how many of them take advantage of the Affordable Care Act, but to the point that the premiums are affordable, in order to get them affordable for people who need them, what happens is they end up with very, very high deductibles. It could be as high as $5,000, and obviously a lot of patients would take that and roll the dice. Do you ever see that kind of stuff yourself?
Absolutely. I've had patients who forego medication, who don't have procedures done, don't go for radiology testing, because they find out that they have more to pay out of pocket. When the Affordable Care Act first started, we were seeing about 3 patients a week, literally. People would walk in, they'd figure out they had to pay more, and they'd turn on their heel and walk out of the office. So it's been a challenge, to put it mildly, and it's actually created a growth of a two-tier system. So those people who have insurance are not getting the same standard of care. They're paying a lot more for the privilege of getting nothing than people who are not using their insurance.
Then what would you do, doctor? How would you, it's trite to say how would you fix it, but Republicans want to repeal and replace. Let's say they can do the repeal part. What would you replace it with?
I would replace it with consumer-based health care. Let people know exactly what the cost of their health care is. There's absolutely no transparency. It shouldn't cost you 10 times more to get a procedure done in a hospital than in a freestanding surgery center, for example. It shouldn't cost you so much more money to get a brand name prescription drug. Let the people actually know what things cost, and that would do wonders for competition. It's a monopoly at this point, and it's a lot of winners and unfortunately a lot of losers, which are the patients and the doctors.
Amazing. Doctor, thank you very much for taking the time. We appreciate it. You're out on the front lines there.
It's my pleasure.
It's scary stuff. All right, meantime, we're getting word that Democrats